Well, today I'm doing my community assessment and intervention proposal. So today I'll be comparing Beverly Hills and Waco, Texas, or inside Waco, Texas, and then compare it to Douglas Park, where I live in Columbia, Missouri. It's just a basically what I'm doing is just a presentation focusing on the two neighborhoods I discussed before. So the community demographics, so Beverly Hills, in Waco, Texas, the residential mix. So there's single, there's family and multifamily, mobile homes. I would say kind of one of the biggest points of this is since it is a primary residential and not a lot of, like stores and other stuff like that, um, there isn't a whole lot to do there or wasn't a lot to see other than the homes. And I think one thing I did notice was paying attention to about the housing, about the actual construction around it, and then the people who lived there and kind of seeing them interact. It was much more of a Hispanic and Caucasian based demographic, and they kind of were very strong as a community, which I thought was great compared to Douglas Park, which was a lot more older housing, kind of stock. There was a lot of public housing and apartments. There was government housing, government apartments. In Douglas Park, where I live, there is a little bit of a larger park around that area. But realistically, it was the neighborhoods were quite similar in that sense, whereas much more residential. There was a couple stores, a couple of things, but I would say one great thing is that both communities shared access to obviously pharmacies and clinics, but they were really big on kind of having transportation and some sort of way of getting along and being a tight-knit community. I think there was some similarities that weren't the best. I think the roads could use a lot. With the social determinant of health, you're wanting to build a great environment. You want to have great transportation. You want to have access for food for all individuals. You want there to be safety, and you want to have you want to capitalize on a social community that works together. And I think Beverly Hills, as I said before, it lacked a lot in like the sidewalk and the communication with the environment and with the group of people. Well, Douglas Park kind of had the opposite, where they had all these different centers and all this access to pantries and everything, but being a little more spread out and it wasn't t being taken care of as well. I think that led to a little more of what they struggled with. Beverly Hills also lack sidewalks and lighting. There wasn't really safe space for walking. There was limited space for walking if you were walking on the street. I think both communities really heavily relied on cars. I think Columbia, Missouri did a little better job, or Douglas Park did a better job with public transportation existing, but still, there was just a very heavy dominant of cars. I think being in a bigger town like Columbia, which is a lot more people bike and walk, and it is a lot more college student heavy in that area. Like it's much an easier place to get around. Transportation again, car reliance. I think public transportation can be so much better, safer sidewalks, more sidewalks in all these neighborhoods. Food environments, it was very fast food high, very dense for the fast food in Beverly Hills. While at Douglas Park, there wasn't a whole lot of food like restaurants or stores. There was a couple food pantries scattered throughout on each side, but then also a liquor store, a smoke store, and not really the best for, I mean, how many kids and high schoolers, middle schoolers, and young children are around that area, unfortunately. I would say there was economic stress that was definitely indicated in Columbia, Missouri, especially in Douglas Park, and seeing that obviously there was visible police in Beverly Hills, but there was not as big as a routine in Douglas Park, knowing that there is public housing and there's government housing. They kind of, I would say the city kind of pushes this area away and kind of focuses on other parts like the downtown or like the university side, which is very unfortunate. And socially, I think churches and community centers in both areas were very prominent and were able to provide a great space and social support and also partnerships between the communities and kind of giving access to everybody that lives there. Again, talking about similarities and kind of what just in general going things, especially in Waco, there wasn't other, or especially in Columbia, there wasn't a whole lot of them compared to Waco, where every couple blocks you'd kind of see like a very well done kind of like two spot housing where it's just very well done, very well built. Again, car-centric travel, transit available, but also underutilized in both areas. The presence of community, the presence of great organizations of different churches, different religions, different places of worship. Doesn't matter if you're spiritual or much more religious or spiritual, like you're able to practice, which I think is great. Um, Having those faith-based communities and then also just organizations that aren't faith-based, I think is also great, offering, just new outlooks on life or new ways out. There was proximity to pharmacies and basic health services in both areas. Obviously, being in Douglas Park, you're right next to the University of Missouri, which has MU Health, which is a humongous hospital. It's where they have their med school. They have all different types of research that's for different cancers, etc. So, much bigger of an opportunity. I mean, obviously in Waco, you're close to Baylor Scott and White, but not to the same degree of being like a 5 minute drive. It's like a 15 to 30 minute drive. Then again, their street maintenances were both very poor, I would say, especially in going into the not nicer areas like Douglas Park, and then Beverly Hills is all right, but they still lacked in government funding or just lacked in maintenance of the streets, having street lights, having, provided light and safety for children or anybody else going on walks, as well as making sure that there are people, like the people are accounted for. They highlighted just how like this humongous park that they had in different open spaces where there wasn't housing and there kids able to play. And then at this park right next to high school and middle school, children were able to play, go outside, have a great time, and really get to explore and, you know, just play around. Different sporting outfits there. Beverly Hills, there was kind of a mix of services, different businesses, if that's construction, lawn care, stuff like that. Barber shops. There was a couple restaurants, as if that's taquerias or fast food. There was a liquor store there. While Douglas Park was maybe a couple thrift stores. There was wasn't a whole lot of restaurants. There was a smoke shop, a liquor store, not really in the nicest area. Protective Services Beverly had a visible police presence right when you entered Beverly Hills. There was a community service center which is run by Beverly Hills Police Department. Douglas Park, a little less routine. The police station and the fire department and emergency medicine all are located in the downtown area or near the university or MU Health, which was not unfortunate to see, but you really only hear the police or fire department when some things and when there's an emergency happening. Schools, Beverly Hills has the Harmony School, which is a public university or public school that children are able to go to. Douglas Park had multiple schools. They had one for very young children. They had a middle school and they also had a high school, kind of all located a couple blocks away from each other, but also like all near the park. Douglas Park High School is right on the park where the kids are able to practice or do whatever outside, which is great. And I think one thing is that the identity of each neighborhood is much different. I think Douglas Park has a multitude, or just has much more historic significance to it. Where I live, Noble Court, there's the first black subdivision of Columbia, Missouri. There's the um, first black church in Columbia, Missouri, of the Fifth Christian Church, a couple blocks down the road. So they have such great historic history behind it, and they're very proud of it. And they continue to practice and preach. Having like mobile markets or kind of areas where people like much more access to these foods. That's an EBT or a SNAP, kind of expanding that in that area, and then also. Um, Education on nutrition. I think there was a couple of nutrition or like dietitians around the area, and then also you could use the students who are nutrition majors, and they could educate the people around the towns and kind of have like open discussions or even just ways to inform and educate the youth, educate the older individuals, educate whoever's living in there. I think for physical activity, proposing more safe routes, better sidewalks, more street lights, have park programs, have exercising outside, have things that involve the community, and then also like the schools are able to join together and have different communities or ways to start up with each other. For policy changes, having complete streets and zoning adjustments, making sure there's an actual support or a need for like grocery stores and making sure like giving opportunity like, oh, this is where people are going to live. This is where people are going to have a great time. This is where people are going to access groceries that are obviously accessible for everyone, but also en route and are close enough that is healthy. Transportation, having more bus routes align through the cities and not just on the main streets, having them stop by specific neighborhoods, or obviously if it's at the government housing or government apartments, like making sure those are taken care of. And then obviously health literacy, making sure that the culture and the different cultures and ethnicities are being taken care of. Um, I would say respecting all materials, all sets of worship, if it's different communities, if it's different races, if it's different ethnic groups or different cultural groups that meet up, like make sure that they're taken care of, but they're also informing others of what their lifestyle is and obviously not fully inviting them, but being able to give them an opportunity to learn and kind of see what their lifestyle is like. Um, Tying in or kind of recommendations to tie in social determinants of health and the outcome of what I want from this. I want to improve and build food environment, build, improve the buildings, and then also food environments there, enhancing access and safety for everybody. I think the directions or recommendations that I gave before this, they address social risks because I'm trying to improve and build the food safety and access for individuals. I want sure to be that the food environments that they're accessible but also safe, that they're healthy, that they're fresh for these people to consume, increasing the safety of the actual city with more street lights, more police department, I don't know, just safety or fire departments, make sure that they're taking their rounds and being more accessible to the area. Obviously, there's expected reduction in like right now Columbia has a kind of a higher density of obesity in this area. So having expect like trying to reduce the obesity in this area, the hypertension, the diabetes, and then improving mental well-being. So if that's physical fitness, if that's a walk around the park or some sort of indoor facility that they have here, like having walking classes or having different ways to inform the youth and making sure that we're taking care of the youth, but also the elderly and also adults of all ages, also aligning with the CDC, with the HHS, with the USDA, and AHRQ, make sure that there's best practices being put in place for its safety for all clinicians, all practitioners, all regular citizens that are here and helping out. And then also finally focusing on equity so that targeting low access areas, designing with the historic neighborhoods, bringing those together, bringing people from different neighborhoods in Columbia together to work together. Why you should fund this proposal? I believe that this proposal demonstrates a clear understanding of both the health determinants and offers feasibility and an innovative solution. We're trying to leverage existing infrastructures like the parks that are here, um, the schools, the churches, and make sure that there is a cost effective and sustainability in the city of Missouri or in Columbia, Missouri, especially in Douglas Park that may not be given the best or the most amount of money, or the best look due to kind of the quote unquote lower class that lives here, but giving them an opportunity to prove their worth. And I think when you have these kind of ideas of the mobile markets, having navigators or people coming from the school and providing educational or like educational sessions or having students teach or inform the people that live there about different ways, if that's exercise, nutrition, social health, mental health, giving these students an opportunity to teach and learn, but also these people to for these people to teach and learn others around them, so more people come out and have a healthier lifestyle in general. Input activities are what can go through it, and then the outcomes out of it, or the output, and then the outcomes out of it. This model illustrates that the resources and the activities which will lead to outcomes. So inputs including community service, partnerships, fundings, speeches, kind of advertising and marketing for what we're going to do, which activities would be nutrition courses, park programs, mobile markets, and just different ways to access to the community and go to different community centers or get in touch with the different Christian groups or worship groups and see what you could do together. And that would output and hopefully an increased access to healthy food, improve sidewalks, improve safety if we're going to have these park programs or kind of safety programs put in place or try to get funding for the actual city. And then from there, if we're allowed to increase the access to health in general, that's also protection, that's also safety of every single person. That's accessibility later at night or having availability of different parts of the park or the city that are more accessible, not just during the day, but also at night. And hopefully that outcome reduces, better chronic disease management, better lifestyle, better health, reducing that obesity, reducing the rate of hypertension in these individuals, but I don't know, creating a healthier lifestyle and letting the city of Columbia, especially Douglas Park, deserve the focus and attention that it needs.